I want every American to be prepared for the hard days that lie ahead. We're going to go through a very tough 2 weeks. And then hopefully, as the experts are predicting, as I think a lot of us are predicting after having studied it so hard, you're going to start seeing some real light at the end of the tunnel.
Pongan mucha atención porque la pandemia por COVID-19 está recobrando fuerza aquí en Estados Unidos.
COVID-related deaths are on the rise in this country.
COVID cases soaring across the country.
Arizona vive su tercer pico de coronavirus desde que inició la pandemia.
Now claim more than 902,000 lives in the United States.
Latinx immigrants have poor mental health due to their past traumatic experiences, the fear of getting tested for COVID-19 due to propaganda, and not having access to accurate vaccination information because of biased news anchors. Instead, the federal government should provide Latinx immigrants the proper medical care and inform them about the vaccine and COVID's effects. By informing the Latinx immigrants on the effects of COVID and providing unbiased opinions on the vaccine, COVID cases will decrease tremendously. Many communities have faced backlash for the uprising COVID cases, especially the Latinx immigrant community. The Latinx immigrant community has not only suffered physically, but mentally because of the pandemic. An example of this is Dr. Viviana Martinez Bianchi, a professor at Duke University and co-founder of Latin19. Even though she is a doctor at Duke, so in a position of power in some ways, she's also always trying to make sure the community's voices are well heard. Mariana, co-founder of Latin19, states, Latin19 shares health messages with Latinx residents on COVID and how it spreads and informs them where they can get tested and how to apply for the vaccine. The Centers for Disease Control and Prevention, CDC, known as the nation's health protection agency, states over 40% of Latinx adults surveyed reported symptoms of depression during the pandemic, with societal worries such as not having the ability to seek proper and needed medical attention. An anonymous Latinx immigrant we interviewed shared her experiences with COVID-19 and how she was affected.
Yo siempre, desde que empezó la pandemia, tenía miedo. Siempre pensaba, ojalá que a mis hijos no les vaya a dar, ni a mi esposo, ni a mí. Y pues, así pasó un año, pero desgraciadamente, cuando mi hijo regresó a la escuela, que ya iban a ir personalmente, mi hijo más pequeño se enfermó en la escuela y él cuando fue al hospital, al doctor le dijeron que tenía COVID. Desgraciadamente no nos habíamos vacunado. Gracias a Dios yo recibí el apoyo de mis hijos, de mi esposo y de mi familia y amigos que oraban por mí. Yo, como les dije al principio, soy tan católica que le pedía mucho a Dios y a la Virgencita que me dejara para mis hijos, que tenía tanto miedo de que yo no estuviera con ellos, y gracias a Dios voy superándolo poco a poco.
Improper housing does not provide proper quarantine space for Latinx citizens who were or are infected with COVID. An interview of a mother describing how she and her family dealt with the virus describes this condition.
My son, he contracted COVID first, and I tried to quarantine him. But then, because of the air ventilation, that we don't have very good air ventilation, so we all contracted COVID again. And it was very difficult. We all wearing masks at home, doing our part, cleaning ourselves, Lysol, disinfecting everywhere. But it was still very, very difficult because there is no space for us to quarantine properly. Yeah.
After one person contracted the virus, it was not difficult for it to travel to another person, especially if there wasn't enough space. Having to worry about the physical health of everyone in the house someone lives in is a stressful thing to do when they can't get the proper resources to prevent it from happening. Across the demographic board, Hispanic/Latino Americans are the most at risk, averaging out higher than both white non-Hispanic Americans and African Americans. Hispanic and/or Latino identifying adults express more stress about not having stable housing, 20.7%, than white adults, 9.2%. When people can't get to a place where they feel safe, not only is their physical health compromised, but their mental health as well. If we provided more available housing opportunities for those struggling to find a place to live, people would feel safer throughout their everyday lives. And some of those who do have a place to sleep at night face constant discomfort because of conditions that don't get taken care of. Leaking ceilings, holes, a lack of ventilation, other complex issues. Chinese journalist Yondin Latu calls for government intervention to deal with the unscrupulous property owners who who continue to profit while tenants struggle to meet monthly payments as the health emergency takes its toll on jobs and income. Some might say COVID-19 has allowed people to seek employment opportunities and benefits such as remote working. A Latinx manager from a Wingstop near the South Dallas area in Texas stated how in his Wingstop location, not many employees were laid off from work, and he didn't hear of other employers near the area who would fire employees due to their status or race. He himself did not face any racial discrimination among his coworkers or employers.
Start firing people that are predominantly Latinx?
Not really. No, not many businesses have been doing that lately. It's really hard for people to find jobs right now, so it's even harder for the businesses to keep people hiring. So they don't really do much firing right now.
Alright, and does the immigrant status or name affect a person's applications?
No.
Now, post-COVID-19, employers offered remote working opportunities to offer a safe working environment. The Pew Research Center states, prior to the coronavirus outbreak, only 20% of employed adults worked from home. By October 2020, that number soared to 71%. Many on social media outlets have shared their experiences with working remotely. Lysandra shared on Instagram how great her experience remote working has been and the many opportunities that arose when she transitioned to remote working. Corporate tech work is easier to do remotely, so she decided not to renew her lease at the company she worked at and began to seek different job opportunities. She did not face many COVID challenges and sees the positive aspects of COVID, which is remote working. Some people haven't been affected by the pandemic and have even prospered through this by having easier jobs, opportunities to work from home, and an increase of job availability. But that isn't the case for everyone. Graduates from New Jersey Medical School state many do not qualify for state unemployment or for payments from the Coronavirus Aid Relief and Economic Security Act, and therefore cannot afford to stop working in low-paying jobs in poorly regulated industries. Latinx immigrants are at the hands of their employers because of their legal status and take advantage of them. The government did nothing to help immigrant families here in the U.S. by providing stimulus checks or food stamps. There is a 40% higher chance of a Latinx person being fired on the spot compared to other races, and employers are more hesitant to employ someone with a Hispanic-sounding last name because of the possible language barrier. Pablo Torres has stated how he faced racial discrimination during the peak of the pandemic because an employer assumed his English dialect, stating, "My wife was expecting and I needed to be able to actually support them properly and pay the bills." Applying to multiple places, but in one instance they wouldn't even open my application. He didn't even look through my experience on my application, and I had to go up there and ask the employer about the status of my application. He told me that it was because of my surname and my race, saying that I probably didn't even speak English correctly. I was extremely upset and lost hope and felt much worse after questioning why. Due to many Latinx being provided with propaganda about the vaccine being dangerous and led to losing jobs because companies were requiring employees to be fully vaccinated. Most jobs were closed, such as restaurants and retail stores, so immigrants had to work in construction, agriculture, and meat processing units, which spread COVID-19 around even more, which was the only way some Latinx families could provide for their families financially. The U.S. Bureau of Labor Statistics has stated that Latinx people are being targeted the hardest with the economic crisis. Companies that offer more jobs and opportunities for the Latinx community can prevent unemployment and push the government to do their job and pay the families that are unemployed their stimulus check, can prevent poverty and provide security to families living on a fixed income to pay rent. Addressing the issue will prevent this from happening when another variant comes around, or prevent the shock of unemployment if another pandemic occurs. Fixing this issue will help future Latinx generations grow and prosper. Latinx immigrants and their families face discrimination and receive hateful treatment from privileged people, having to endure those things although they have done nothing wrong. We as people, as Latinos, should start to not be afraid to speak up. We as people, as Latinos, should start to help others in need, especially due to catastrophic events like COVID-19. We as people, as Latinos, should become more educated on what occurs in our communities and the world. Juntos, unidos, podemos hacer cambio en nuestras comunidades.
Soy un inmigrante más de los Estados Unidos.
Yo soy inmigrante.
Yo soy inmigrante.
Yo soy inmigrante.
Yo soy inmigrante.
Soy inmigrante.
Yo soy inmigrante. Yo soy inmigrante.
Yo soy inmigrante.
Soy un inmigrante.
Yo soy inmigrante. Y tengo una voz.